Part 2, Understanding Mental Illness. Mental illness refers to a variety of mental health conditions. These are disorders of one's mood, thinking, and behavior, including depression and bipolar disorder, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. Many of us have had mental health concerns, but a concern becomes a mental illness when signs and symptoms cause frequent distress and affect one's ability to function. Such illnesses can make one miserable and cause problems in one's daily life, in work, and in relationships. In most cases, these symptoms can be managed with medication and counseling, psychotherapy. Symptoms of mental illness. Symptoms and signs vary depending on the particular disorder and the circumstances. The emotions, thoughts, and behavior are affected. Behavior disorders are physical activities reflecting distress from disturbed thoughts or feelings. One may demonstrate passivity, immobility, agitation, jealousy, fearfulness, anger, rage, and so on. One episode of illness can present with several signs or symptoms: feeling sad or down, fears or worries, extreme mood change, high or low, withdrawal from friends, family, or activities, major tiredness, low energy, sleeping problems, confused thinking or reduced ability to concentrate, excessive detachment from reality, delusions, excessive suspicions, paranoia, hallucinations, inner voices often criticizing oneself, inability to cope with daily problems, stresses, financial troubles, extreme feelings of guilt, blame, alcohol or drug abuse, big changes in eating habits, sex drive changes, excessive anger, hostility, violent outburst, suicidal thinking. In some types of mental illness, such as bipolar disorder or schizophrenia, the sufferer is not able to recognize the extent of the problems. Family members, friends, or co-workers may be the first to do so. Seeking help. If these signs and symptoms occur, one should promptly see a physician or mental health provider. Most of these illnesses do not get better on their own, and untreated, get worse over time. A significant number of clients may experience a persistent lack of recognition of one's illness known as anosognosia. This greatly complicates their control of their health. Suicidal thoughts. Particularly in the early stages of mental illness, for some individuals, strongly compelling and troubling dark feelings and thoughts of suicide or harming oneself or others can arise. These thoughts can be very persistent and controlling. Immediate action to get help is needed. Call 911. First responders have great understanding of this common problem. Call the crisis hotline for New Mexico at 1-855-662-7474 or 1-855-NM-CRISIS. Do not hide the feelings. Contact a friend or loved one. Contact a minister or spiritual leader or someone in one's faith community. Contact a doctor or other health provider. These thoughts do not get better on their own. One must get immediate help for this emergency, and the help is readily available. Causes. Disorders of the mind and brain are like other medical physical illnesses in that they are thought to arise from a variety of genetic and environmental factors. Inherited traits. Mental illness is more common in people whose biological or blood relatives also have a mental illness. Genes may increase one's risk of developing an illness, and one's life situation may trigger the actual mental illness event. Environmental exposures. Exposures in the womb to viruses, toxins, alcohol, or drugs can be linked to mental illness. Later in life, use or abuse of alcohol, legal or illegal drugs, or mind-altering substances can predispose to mental illness developing. Negative life experiences. Life situations, loss of loved ones, financial problems, domestic violence and abuse, poor self-esteem, etc. All these can lead to distorted ways of thinking with guilt and self-blame. Again, a disorder of feelings, thoughts, and behavior can arise. Brain chemistry. Biochemical changes in the brain are thought to affect mood and other aspects of mental health. Brain chemicals, neurotransmitters, or hormonal imbalances affect mental health. Inherited traits, life experiences, and biological factors can affect brain chemistry linked to mental illness. Risk factors. The causal factors just mentioned predispose to mental illness along with other factors: chronic physical medical conditions, brain damage from trauma, lack of friends, lack of healthy relationships, previous history of mental illness, childhood neglect and abuse. 1 in 4 adults have a mental illness in a given year. 1 in 2 of all adults will have experienced a mental illness in their lifetime since childhood. Complications. Mental illness is a leading cause of disability. Reduced quality of life, less enjoyment, unhappiness. Untreated, it can cause severe emotional, behavior, physical problems, legal and financial problems, family conflicts, relationship difficulties, social isolation, tobacco, alcohol, drug problems, missed work or school, poverty, homelessness, self-harm and harm to others, including suicide and homicide, increased risk of motor vehicle accidents, weakened immune system prone to infection, heart disease, and other medical conditions. If one is seeking help or is offered medical help for symptoms of mental illness, getting ready for the appointment is similar to a regular new appointment for medical care.
I kind of make the analogy to other medical problems, like diabetes. If you're diabetic, your doctor talks to you about diet and exercise and all the things you can do to take care of yourself, but they might also prescribe medication that can help control your blood sugar. If you have a psychiatric illness, I kind of look at therapy as diet and exercise for the brain. So medication can help some people, therapy can help some people do better with both. And it's a real individual thing.
What to do for the appointment? Write down the symptoms that have been noticed. Write key past history of traumas, current stresses, injuries. List medical history of other health conditions, medications, dietary supplements. One should take along a family member or friend who can help one recall important information and help to understand what is said at an evaluation.
I think from a family perspective, we always really value having their input on what they've seen going on, because what the person experiencing an illness perceives and what the people around them see are two different things, and all of that is really important information in figuring out ways to help people cope. I think the most important thing is don't be afraid to come and ask for help, and the more people tell us about what their symptoms are like for them and exactly what's happening from their perspective, the more we can help them. Sometimes we see people who the symptoms are very frightening, and so they're afraid to talk about them, and they hold back, and that just makes it harder to find ways to really help people learn to manage their illness.
A patient's client's questions for the visit. What type of mental illness might this be? Why can't one get over this on one's own? How is this type of illness treated? Will counseling or psychotherapy help? Are there medications that might help? How long will treatment take? When will one be better? How can one help oneself? Are there materials to read that one can receive? Are there recommended websites?
Going to the doctor and asking for information on your disease is like asking for information on your life. You have lived your life and you know what your life is. But the fact of the matter is that you are the expert on your life and you are the champion of your life. And so be prepared to go in and talk about your life. Because you know more about your life than the doctor does. And although he or she may be the one at the end who gives you that final insurance code, the final code that will get him or her paid, what really matters is the fact that you go up and down and in and out and funny things go into your head, and that's the case. But in the end, so much of it comes down to you and your gumption and your ability to put one foot ahead of the other, and say, I think I need to know more about that mania. I think I need to know more about those psychotic features. Just what does that mean? Wikipedia is a great source. You know, it's always a source I start with, and then go off from there. And there are books aplenty you can buy, and they're all over the place. People are writing every day about this sort of stuff.
Now, the doctor's questions. There will be questions about one's mood, thoughts, and behavior.
The major thing that we focus on is getting a really complete history of when did it start, how did it progress, how much is this affecting how you're working or going to school, or affecting your relationships, or other parts of your life that you would like to be more functional in.
When did you first notice symptoms? How do symptoms affect one's daily activity? Has one had treatment for mental illness before? And if so, when and what? What has one done to try to feel better or try to control the symptoms? What things make one feel worse? Have friends or family members commented on one's mood or behavior? Does one have biological blood relatives with a mental illness? What does one hope to gain from treatment? Goals. What are the medications one is taking now? Is there any alcohol use or abuse? Any abuse of prescription or street drugs?
I always tell people my major focus is not to make a diagnosis. My focus is to find out what are the symptoms that bother you. Because as someone who prescribes medications, if I know what the symptoms are, it helps me figure out, well, what medication might help with that, or what other kind of therapy might help with that particular symptom. I think one frustration a lot of people have if they've been involved in the mental health system over time is they keep changing my diagnosis. And that happens a lot because people's symptoms change over time and different things happen. And so someone who sees you this year might not see the same thing that someone who sees you 5 years from now sees. So they may use a different label. In a sense, I'm not sure the label is as important as how are you functioning in the world every day and how can we help you do that better.
There will be a physical exam looking for physical problems that could cause the symptoms one has been having. Lab tests such as thyroid or other hormones, abnormal blood chemistry, or blood cell count side effects that could interfere with treatment are checked. The psychological evaluation will again ask about symptoms, thoughts, feelings, and behaviors. One may be asked to complete a written questionnaire on these topics. Which mental illness might one have? To determine the correct diagnosis, several interviews, a trial course of medication, and some passage of time may be required. Main classes of mental illness. Mood disorders affect how one feels emotionally, such as sadness or happiness. Depression and bipolar disorders are included. Anxiety disorders are feelings anticipating future danger or misfortune, also feeling very ill at ease. These include anxiety disorder, panic disorder, obsessive compulsive disorder, phobias, and post-traumatic stress disorder, PTSD. Psychotic disorders cause detachment from reality, delusions, paranoia, extreme suspicions, and hallucinations, voices intruding into one's consciousness. Individuals with schizophrenia most commonly experience these, but bipolar disorder and depression can present these also. Substance-related disorders may include misuse of alcohol and legal and illegal drugs. The misuse is problematic in and of itself, but greatly complicates other mental illness in which this misuse is common. Personality disorders involve a lasting pattern of emotional instability and unhealthy, risky behaviors causing problems in one's life and relationships. These include borderline personality disorder and antisocial personality disorder. Other conditions include disorders of impulse control, sleep, and sexual functioning. Treatment. Modern physical or mental health care is commonly practiced in a team model. The team will seek to secure stable housing or shelter as a first step to treatment of mental illness. The team will commonly be composed of a primary care provider, psychiatrist, psychotherapist, pharmacist, social worker or case manager, and family members, friends, and loved ones. In regions with large remote rural populations, telemedicine links are showing promise in offering regular, repeated access to behavioral health care and protecting anonymity of clients in small, close communities.
So as he or she gets to know you, that's another matter. You know, he'll come to appreciate the effects of the disorder upon your life, and this is where the treatment guardians come into it also. It's not my favorite program, but it's an okay program in that if the person takes an interest in you, they will do so. And they'll enter your life in such a way to make sure that you take your meds and you do the things you should do, and they'll teach you skills and they'll bring you back to the point where you are stable in life and in existence. And then you can move forward. And that's the purpose, moving forward. That's why I go to my psychiatrist to take that step one in front of the other. And that's why you deal with a treatment guardian, is so that you can take a step one in front of the other.
Medications. Psychiatric medications do not cure mental illness, but they often significantly improve symptoms. The medications can help other treatments, such as psychotherapy, be more effective. Many chronic medical illnesses are treated over extended time to promote gradual healing and recovery, which is the goal in mental health treatment. The best treatment is determined by the situation and one's response to the medication.
The thing I struggle with is people often are afraid of taking medications because they worry that we want to do something to make them feel a certain way or make them behave a certain way. And I think it's really important to never start a medication unless you feel comfortable taking it. If someone prescribes a medication and you feel anxious about it or you're worried about it, you should ask them to explain fully until you feel comfortable trying it. If you take a medication and you don't like how it works or it makes you feel bad in any way, most important thing is call the person who prescribed it right away and say, here's what's going on, I don't like this, what else can we do? I think sometimes people think that if we come up with a recommendation, that's the only option, but we have a lot of options and a lot of things that we can try. If the first thing doesn't work, we can try something else, just as we would do for diabetes or blood pressure or cholesterol or any other medical issue.
Commonly used classes of medications, not all inclusive. Antidepressant medications. Antidepressants are used to treat various types of depression and other conditions, such as chronic pain. These medicines can help improve sadness, hopelessness, lack of energy, difficulty concentrating, lack of interest in activities. They are grouped by their brain chemistry effects. Mood-stabilizing medications. These medicines are used to treat bipolar disorder, which has alternating episodes of depression and mania, grandiose ideas with highly impulsive, imprudent activity. Mood stabilizers plus antidepressants can be used to treat clinical depression. Anti-anxiety medications. Anti-anxiety medications are used to treat generalized anxiety disorder or panic disorder. These may also reduce agitation and insomnia. They are fast-acting, helping to relieve symptoms in 30 to 60 minutes. But there's a major drawback: potential drug dependency. Antipsychotic medications, known as neuroleptics. These medications are used to treat psychotic disorders such as schizophrenia and bipolar disorder. They can be combined with antidepressants to treat depression.
Most frequently and most embarrassingly, the side effects to these drugs are sexual. And most people are not going to have the gumption to ask about sexual side effects. So you should really get up the gumption to ask about them, because they're going to have some. And you cannot live a normal quality life without a sexual function to your life. And so you should probably think to ask the person prescribing you what's the impact on your sexual functioning of this drug, because it's a trade-off you're going to have to make, one for the other.
Psychotherapy. Psychotherapy is also called talk therapy or psychological counseling, and is a process of treating mental illness by talking about one's symptoms and related issues with a mental health provider. During psychotherapy, one learns about one's condition, moods, feelings, thoughts, and behaviors. Insights and knowledge help one learn to cope and manage stress. There are many types of psychotherapy and can be one-on-one, group therapy, and may include family members for the benefit of all involved. Brain stimulation treatments. These treatments are used for depression and some other mental health disorders. They are reserved for situations in which medications and psychotherapy have not been sufficient. Electroconvulsive therapy, ECT, transcranial magnet stimulation, vagus nerve stimulation, and a currently experimental therapy, deep brain stimulation, are used. It is important that the risks and benefits be understood. Hospitalization and residential treatment programs. Mental illness can become so severe that one needs psychiatric hospitalization. This is recommended when one cannot care for oneself and is in immediate danger of harming oneself or someone else. This can be 24-hour inpatient care, day hospitalization, or residential treatment with a supportive place to live. One can receive intensive outpatient treatment from a specially trained team, such as ACT, Assertive Community Treatment Team. Substance abuse treatment. Substance abuse commonly occurs along with mental illness. It often worsens mental illness and interferes with treatment and recovery. Specific treatment of substance abuse is crucial. Psychotherapy for insights, medication to ease withdrawal symptoms or cravings, inpatient treatment for withdrawal, detox treatment, outpatient programs for monitoring sobriety, and support groups or 12-step programs such as Alcoholics Anonymous are in the array of treatment resources. Participating actively in one's own care. In consultation with the mental health treatment provider, one chooses the treatment plan and goals that best suit the client based on one's preferences, symptoms, severity, and side effects. One must follow the plan faithfully and notify the provider of circumstances that interfere with taking one's medications or keeping appointments. Staying physically active eases symptoms, and avoiding substance abuse is part of the agreed plan.
What I see sometimes happens is people say, well, it's not as bad as it was, so that's good enough for now, and that's not what we consider adequate management. And management being therapy, learning life skills, participating in other activities that help you enjoy your day, all of that is part of the treatment plan. And in most facilities or most offices, we actually do what we call a treatment plan that incorporates all those different aspects. And it's really the patient's treatment plan. I emphasize that to them. I say, this is your plan. If you don't like it, tell me how you want to change it. And the more people participate in making their own treatment plan, the more that helps us know what are the things they're not doing now that they would like to do. And then we can help brainstorm about how to help that happen.
Sometimes a mental illness may be so severe that a doctor, along with a designated loved one or a court-appointed temporary mental health treatment guardian, may need to guide one's care. This status is in effect until one is well enough to fully participate in decision-making. The courts oversee this care and protect the client during such period or periods of dependency. For more information, please see Part 4 of this video on the role of the treatment guardian. Coping and support. For those with mental illness, coping with life is especially challenging. Coping skills can improve through talking to one's doctor, therapist, family, or friends. Including family or friends in the process helps them understand and learn more from the beginning of diagnosis and treatment. Keeping them informed of progress can be very encouraging for all parties involved. Good communication is better for the clients, providers, family, and friends. These illnesses harm valuable relationships in ways that are hallmarks of the illnesses. Stigma is greatly aggravated by alienation and misunderstanding. Clients or consumers can ease some tension by permitting specifically limited information to be shared with family or loved ones. The client-patient rights of confidentiality are very closely followed in such communication. Support groups. One can connect with other individuals and their families in support groups for mental illness. The National Alliance on Mental Illness, NAMI, is one agency that can help such persons contact other clients and families who are knowledgeable and sympathetic to those suffering with mental illness. You can contact them at www.nami.org or call 1-800-950-6264, 1-800-950-NAMI. Prevention. The feelings and thoughts that mark the beginning of one's illness can recur and intrude repeatedly. One can learn to recognize warning flags in symptoms and follow a plan to ease the impact and avoid worsening illness. Sharing with others, addressing one's needs, controlling stress, recovering lost self-esteem, and developing more insight can build one's resilience or resistance to relapses. One benefits from maintaining good general health with a health provider's guidance. Promptly reporting setbacks before symptoms get bad is very beneficial. All these, good sleep, eating habits, and regular physical activity help heal and maintain a healthy mind and body. Certainly, avoiding smoking and substance abuse and alcohol abuse have long-term and immediate health benefits. Conclusion. Mental illness is an extremely common illness from which half of us will suffer in a lifetime. Early recognition and prompt treatments are beneficial and more effective than delaying treatment. These are disorders of thoughts, feelings, and behaviors that in serious mental illness will not get better by themselves. These illnesses currently cannot be cured, but the symptoms can be managed by a mental health professional. The objectives are to control and reduce symptoms, promote recovered functional capacity, and inform clients and families of the nature of mental illness. Ideally, the client will learn to control the symptoms and reduce relapses of illness.